So today, I thought you did very good with cueing the patient throughout the therapeutic exercises. One example was when we were on the shuttle doing the bilateral leg press. It was, you were cueing her not to keep her knees in, and you were also telling her to control the eccentric phase better, which I thought was very good. A few things you can work on. One was when you were performing the over test, you had her leg straightened out one time, and then you had it bent or flexed the other time. When I believe in class it was 30 degrees of knee flexion required to do the overs test.
Okay.
And then the other thing is documentation. So when we were doing it with Dr. Pfister, he said the assessment part needed to be worked on. It needs to be less objective and more about our prognosis and what we think about the course of action going on with the patient, as well as things that we did such as cueing the patient, or if they had pain during a certain time and what we think about it.
Okay.
All right.
Today I thought you did really, really well with setting up the exercises and explaining to the patients what we were going to be doing. I thought you also did very well with verbal cueing and instructing them on how to improve their form. Something you need to work on is your documentation as well, more subjective than assessment. So it's kind of difficult to get the subjective section to flow kind of well. So it was kind of choppy, and you added repetitive information a couple of times. So you just need to work on that. And when we were working with our first patient today, you were overguarding her. And I know she seemed like a fall risk, and she was, but she is modified independent, so you really didn't need to be holding onto the gait belt, just like supervision and have your hand nearby in case like she lost her balance. Okay.
All right.